Thanks, Jacqueline. Hey, everybody. Welcome to the webinar today. And thanks for sharing your time with us. I'm Tarun Nimagata. I'm the founder and CEO of ReturnSafe. And today I'm joined by Stephen Alderman, who's the Vice President and General Counsel of the South Texas College of Law in Houston, and Colin Gwynn, who's the Vice President of Education for ReturnSafe. Just a quick introduction. I started about in February and March paying attention to what was going on with COVID, and came to the conclusion that here in America we were going to be pretty unprepared for what was about to happen, and got together with a few very talented people and started ReturnSafe so that we could be of service to schools and offices that were trying to do the very difficult job of reopening in the middle of a pandemic. And Stephen has been an early believer in ReturnSafe, and the South Texas College of Law has done an incredible job of taking our technology and rolling out the technology. This is not the only thing that they're doing to protect against COVID-19 and reopen safely. So excited to hear from him about the measures that they've taken, both with the ReturnSafe product and also more broadly as well. And then after that, we're going to hear from Colin, who's going to do a demonstration of the product, and then we'll all be available to ask questions. Feel free to ask questions along the way, and we'll be able to pick them up and ask them on your behalf to the speakers. So with that, let me hand it over to Stephen.
Okay, great. Well, thanks, Tarun. Thank you, everybody, for the opportunity to talk about how South Texas College of Law Houston has approached reopening for this fall semester. As we're all experiencing, this is a very difficult time, especially in balancing our respective missions with keeping our communities healthy and safe. So hopefully something that we talk about today will be beneficial at your campuses. Just some quick context for my comments. I have 15 years of leadership experience in higher ed and have several more years as a faculty member. My current role, as Tarun mentioned, I'm the Vice President General Counsel at South Texas. And part of that role, I also oversee the HR department as well as safety and security. The campus, we are just a law school. We're not part of a large university. So we're an independent private law school in downtown Houston. We are non-residential, again, located in basically one block of several mid and high-rise buildings. So if we, really for my part today, what I wanted to talk about is how we at the law school approached the whole situation of do we open for the fall semester? And if so, how do we do that as safely as possible? Really, we talked through just briefly some of the things that we did that we think have served us well, but then also talk about the technology component and why we decided to partner up with ReturnSafe. So we can hit the next slide, please. Really, we had two primary goals, as I'm sure all campuses and schools have. The first goal was the goal above all others, which is making sure that our entire community is healthy and safe. Our second goal, then obviously, keeping the first goal in mind, the second goal is, again, how do we provide the best legal education and bar prep for our bar prep students? How do we provide that considering the current situation, the current context? What we realized kind of quickly is we didn't even really know whether or not our students had an appetite for being on campus. So we went ahead and did put together a quick survey that surveyed the faculty and the students to determine whether or not they even wanted to be on campus. What we found out after doing that was we had basically a third of our student body that had a significant desire to be on campus. So what we then had to do is shift our focus to, okay, how do we then serve 1/3 of our student population as safely as possible in the building, with the idea, again, of we don't want to just open to close, we want to open for the entire semester. So what we did at that point is what a lot of you have probably already done or are in the process of doing. We created as many safe distance modular classrooms as we could. We installed plexiglass shields throughout the building, any and all of our high traffic areas, including plexiglass shields encasing the lectern area in each of the classrooms that we would be using. We created a COVID-19 code of conduct, primarily for our students, but also obviously then for our employees, that really governed if you're going to come back into the campus, then you are agreeing to this code of conduct and how you're going to protect your community and protect yourselves. We modified our cleaning schedule and processes. We put hand sanitizer pretty much everywhere throughout the campus, everywhere we could possibly put it, and among many other steps that I won't go through all the gory details because again, you all are living this. But one of the most important things that we did as we were preparing to open is we hired an epidemiologist and his group to come in and basically audit our process, what we were doing, not only from the standpoint of being inside the building, how we were structuring the classrooms, but also the policies that we were implementing, the return to campus protocols if somebody did end up testing positive. They basically went through all of that and provided us with a list of a few things that we needed to improve upon, but also gave us a lot of comfort that we were on the right track to do this as safely as possible. We also had the lead epidemiologist jump on a few town hall meetings with both faculty, staff, and students to walk through his process and his opinion on how we were ready to be open for the fall. So one of the things though that we talked about at that point was, there's no control obviously of what happens outside our building, and the likelihood was very high that at some point somebody that had been exposed to or was infected with COVID-19 would be coming into the building. And because we're a smaller institution with more limited resources, we realize there's no way that we can effectively do manual contact tracing. We just don't have the resource to be able to do that as effectively as we would need to try to keep the doors open and keep the spread from becoming too significant. So this is where we then obviously we turned to technology and how could we best utilize technology. And like I'm sure everybody else on this call, you were probably maybe still are receiving multiple emails a day or week about various solutions and ways that you can address COVID-19 on your campus. We took the normal approach. We interviewed several different vendors and really walked through identifying what we needed for our campus and what was important to us. And through this process, it was a pretty easy choice. We decided to partner with ReturnSafe. What was important to us, as we see on the screen, the first part was important to us. We had the ability, because we're a non-residential campus, to basically funnel everybody through our buildings through one or two checkpoints. So we wanted a customizable daily screening process that everybody coming onto campus would be required before they could enter our building. So what we did is we worked with ReturnSafe and we built our screening process to mirror the CDC recommendations. But we also were able to add in multiple questions that mirrored our own COVID-19 code of conduct. So for example, if anyone has 2 or more symptoms from the CDC list, or a fever, or they have been exposed to someone who has COVID-19 within a relevant period of time, on their screen for the app, they would receive a message that basically says you're not allowed to come to campus. Everybody that comes into campus does have to show their entry screen, which has the date, so we know that that's the relevant for that particular day. And if they don't have that, then they can't come to campus. And if they're a student, then they just have to flip to doing their class online, because all classes, even in person, are able to be accessed online now. part of also, again, what I mentioned was very important to us is leveraging the technology for the contact tracing. And taking really the second and third bullets really had to be balanced together. As you can imagine, um, since we're just a law school, the vast majority of everybody in the building is either a lawyer or they're a lawyer wannabe. So privacy is of utmost importance. So we needed an app that did not actually track where people had been. And so with ReturnSafe, we found the solution that, again, we could have a geo-fenced application that was working just for our building location, but also even within the building, we had people concerned that we would be tracking where they were in the building. So that's, again, where the Bluetooth proximity technology comes very handy for us, because not only is there the privacy of the individual protected as to where they've been outside the building, but also within the building. So for those reasons, we decided that ReturnSafe would be our best option. And thus far, we've had very good luck. We've had very few instances of COVID-19 coming on campus, but the few that we have had, the follow-up and contact tracing has been actually quite simple and easy. So that's it in a nutshell for how we've been balancing this.
That's awesome. Steve, thank you so much for sharing that. This is Colin Gwynn talking here. And I wanted to just kind of open up and see if there were any specific questions for Steve and for how South Texas School of Law has been, how South Texas College of Law has been, handling the situation. And if there's any specific questions now, we can take a couple, and then I'll jump in and give a quick demo of the app, and then we'll do a broader Q&A after the demo of the mobile application and the online portal.
So Colin, I have one here about the timeline. The question is wondering about how bar prep was necessary during the summer and how that impacted the timeline for return to campus. And then obviously the return to campus for the fall semester puts a timeline pressure as well. So maybe Steve could speak to that a little bit.
Sure, yeah, I'll try to. For anybody that has paid attention, the nation has really struggled on a statewide basis relative to the bar exams. And so for Texas in particular, we normally have a July and February exam. So our July exam was canceled. They weren't sure what they were going to do. They finally decided to do a September bar exam and an October bar exam. So for our students in particular, and studying for the bar, it tends to be a short window and intense process. So having the ability to be in the building was critical for a lot of those students. Because again, think about, they're in the process of studying for the bar, they're at home. Most places, most people are staying at home, they're quarantining, or they're working from home. So they didn't have quiet space. They had to get in the building. So we were on a very tight timeline because things just kept moving. We didn't actually decide to come fully on campus. To offer classes on campus until really late July. So we had about 3.5 weeks to finalize everything. We had a lot of stuff in process, but the ReturnSafe app, we had about a week to implement. So our timeline was really tight, but but we made it without any issues.
Thank you, Steve. And we have one more question before we hop to the demo. Were you able to integrate with your single sign-on for the app? And also, is the process the same for faculty and students, or is there a separate process for faculty versus students?
Yeah, great question. So there's one process for anybody entering the building. So the actual process of using the app is the same whether you're a student, faculty, staff, or even a on-site vendor. Visitors that come to the campus, contractors and things, although it's limited, we still have some that need to come on campus. We put a few iPads at the security desk, and we just link directly to the ReturnSafe website for our school. And so they didn't have to have the app on their phone since they're just a visitor. And I apologize, I think I forgot the first part of that question.
It was regarding a single sign-on.
Yeah. Actually, we were not able to. We use I'll just call it a lesser known product for our security badge in. So unfortunately, we were not able to use a single sign-on for that component.
Thank you.
All right, well, I think we'll hold some more questions for the end, and I think we can keep going with the demo.
Okay, fantastic. So one moment here while I am going to first share my screen of my phone so we can look at the mobile app, and then we'll jump into the portal right after that. Okay, cool. So what we're seeing here is for ReturnSafe, we feel like it needs to be a very, very simple interface, and it needs to be very easy to do daily screenings and check-ins. And these screenings and check-ins, as Steve mentioned, many organizations and schools need to be able to customize the questions and the decision trees around when a student or a employee should be coming to school or coming to work. So that's all customizable in the portal. And so the user-facing application is very, very simple. Each day, they're going to go through a basic screening. And so I'll do a couple different scenarios. The first of which is, kind of probably the most standard, which is, no, I have not been tested. Then it says, in the last 14 days, has anyone in your household been exposed to COVID-19 or anyone with COVID-19 symptoms? And have they been in contact? So I'm going to say, no, we have not. Then it says, within the past 14 days, has public or medical professional told you to self-monitor, self-isolate, or self-quarantine? No, they have not. And have I traveled internationally in the last 14 days? No, I have not. And this says, do you currently have a fever of greater than 100.4 or have you in the last 7 days? I haven't. And then it says, are you experiencing any of the following symptoms? So quick symptom checklist, I'm going to say, I have none of the above. So when I say next, it says, my recommendation is that I can come to work today. For school, you can go to school today. When I say done, it's going to show my last update was today at 1:20 p.m. So we can see that I've got this kind of approval to come to work or go to school and when the update was done. Now, the other big functionality of the app is that we want to do kind of a boot and suspenders approach to contact tracing. So when multiple users of the app had the app open, it's automatically doing contact tracing via Bluetooth. And then on top of that, we make it very easy. You've got this person with a plus sign at the bottom right of all the screens. And wherever you are, you can just click that and just very quickly log an activity. So say I had lunch with Elon Musk. We were talking about battery manufacturing and Jakku. And let's see, that lunch was an hour and a half long. So that's been logged. So very, very easy to log activities. And then I'm just going to log one more. I went on break with Jeff and we're talking about drone delivery. It was 30 minutes, confirm and log done. So really, really easy to log these activities. And say it's a new person that's not in there. I just met with somebody. I commuted with, let's see, Sally Smith. Sally@gmail.com. Okay. So really easy to just add a new person. We commuted for 30 minutes, logged. Okay, so that's kind of your day-to-day interaction with the app, is just logging your interactions and contact, studying with, having lunch with, etc. And then, so the next morning, I'm going to log that I have not been tested, and we have not, we've not had exposure to anyone with symptoms in the last several days. We have not been told to self-quarantine, and we've not traveled out of the country. But I do have a fever now, and it's telling me that I need to work from home today because I'm experiencing COVID-19 symptoms. So please take sick leave, etc. So I'm going to say done. I'm working from home today. It shows that, if I were to try to go to school or try to go to work today, I would see that this is my current status. And then I get tested. It says, see a physician if you are immunocompromised. So let's go ahead and say that I went and got tested that day. And the next day I'm going to say, yes, I have been tested and I did test positive. And has it been more than 10 days since your test? No, it has not. So it's going to tell me I need to work from home and, to please take sick leave. So that's kind of my work from home. So this is our app flow of the daily screening and the logging. Now what I want to do is jump over and show what this looks like in our online portal. So we're going to pop out of this for a moment. And here in the portal, let's refresh. So we have a dashboard view, and your dashboard view shows you what percentage of people are coming to work, what percentage are working from home, what percentage have been told to see a doctor. So you can kind of get these high level, understanding of what's going on your campus or at your place of work. Now, what I want to show you is contact tracing, because you can see here I just entered a positive result. And on this positive result, I can see that there's 7 contacts. So when I click that number 7, you can see, and here's Sally Smith that I actually just put in, a 30-minute commute, Jeff Bezos and Elon. We had a break. We had a lunch with Jakku and Elon. So I can go down here and I can actually contact any of these people straight from the app. I can click on their email and help with our kind of contact tracing and contact case management, if you will. So that is the portal, and then there's a lot of customizations that you can do in here around what screening questions you want to ask. What are the different parameters by which it would tell somebody to stay home or to come to school or come to work. That's all customizable depending on what county you're in, what the CDC is requiring. As those requirements change, if there's specific county health requirements, all of that reporting and dashboarding can all be done out of here to show compliance and things like that. So that's a quick look at the daily functionality of the app, how you do the contact tracing, how you do the logging of the contact, and a quick look at the portal. And then, so now I think I'd love to jump back into any questions we may have from the audience on how everything works.
We have a few questions here. One of them, we'd love to jump into privacy a little bit. Could you talk about how the Bluetooth tracking works and how that's, how that protects people's privacy by containing it, to certain locations?
Yes, absolutely. Do you want me to take that, Tarun?
Sure thing.
Yeah, so the way the Bluetooth tracing works is that we don't know where the individuals are because we're not looking at GPS data and actual location data. What we're looking at is if those two individuals' Bluetooth radios are within a 6-foot proximity of each other for more than a certain amount of time, whether that's 5 minutes or 7 minutes, to kind of log an activity. So if the apps are open on people's phones, say we're at the library and somebody sits next to me, we're studying together, those two Bluetooth radios would see each other, and it would just log that I was sitting near or being within proximity of another person for X amount of minutes, and that would be logged as an automatic log. and that happens if both users have the app open on their phone.
Great, thank you. And for the admin portal, who has access to that, and are they able to also see who's checking in every day in addition to the contact tracing data?
Yes, that's right. So in the dashboard, they can see who's checked in for that day, who, you know, you can separate that out by departments if you'd like, or if you have block scheduling, you can have different blocks in there. So that's all customizable within the dashboard and the portal. And generally that's human resources that has access to that. But that's determined by the school or by the company that's rolling out the solution.
Great. And also, sorry, back to the Bluetooth contact tracing. Does it work if the app is not in the foreground, if it's just open in the background?
Yeah, so on iOS, that's a tricky one because, you know, ReturnSafe, as well as any other application that's running on an iPhone, we are all somewhat at the mercy of what iOS iOS 14 allows for. And so there is generally a certain amount of time that once you close the app, it's still running a background process. So in that case, it would be logging the activity, but depending on how long the application has been closed on either user's phone, it may not log that activity if iOS 14 has basically shut down the background process for our application. So that's why we recommend keeping the app open. We even have a pocket mode that turns the screen completely dark except for a little counter on the screen to preserve battery. So if you're, you know, sitting somewhere, you know, studying or something like that, and actually I can show you here. Let me, I'm gonna go back to the phone and show you what this looks like. So this is there's a way that you can basically have it sitting in pocket mode, sit it next to you while you're studying, and you can actually have the app give you physical distancing alerts. So I don't have any physical distancing alerts today because I'm here at my house by myself. But this is, you know, if I turn on pocket mode, it just turns my screen black and tells me how long it's been active to save battery. I can set down my phone, and if somebody else is studying nearby, then it will be logging all of our, logging the interaction automatically. So I'll take it back out of pocket mode.
Great, and I think we have time for one more quick one. Steve, it looked like he answered this in the chat, but I think it'd be great for everyone to hear. So what type of kiosk do you have for the iPads in the, you know, for the visitor screening and check-in? Maybe, do you want to take that one, Steve?
Sure. Yeah. So what we have at the front desk, you know, is we have 2 iPads again, and we just sourced a case that would you know, surround the iPad, but then also could attach to the counter at our security station. So we purchased 2 of those. They were just off of Amazon. We've attached those to the desk, and visitors can use them there. The guard does sanitize each of the iPads after each use.
Great, thank you. Well, it looks like we're right on time here. So we will be sending around a recording of this to everyone. And thank you for joining.